The University of Rochester Medical Center is home to more than 3,000 people dedicated to scientific research studying common and rare illnesses from cancer to influenza. These efforts have led to therapies that have saved countless lives and improved human health locally and across the globe. Now, researchers there are working on the forefront of the coronavirus pandemic. Dr. Angela Branche is an infectious disease specialist who is leading the clinical trials in Rochester to find a vaccine. I had the chance to meet her to hear about her work and how she's helping keep Rochester safe.
Yeah, so this all started for us in January. January 20th, we were at the NIH, National Institute of Health, in Maryland. And this was one of our first meetings of the year because we're part of a national group that studies vaccines and treatments and infections in general and tries to move the science forward and make medicine better. And so at our first meeting, Dr. Anthony Fauci, who is one of the leaders of the NIH, comes into the room and he says, so have you guys heard of COVID-19, the coronavirus coming out of China? And he said, I think this is going to be a real problem for our country and for the world. And so the first thing I want this group to do is to start getting ready and mobilizing your forces to start studying this virus and start helping to develop treatments and vaccines.
Dr. Branche told me that the first case of COVID-19 was diagnosed in the United States later that night. So her and her team immediately began working on possible treatments.
We were part of the group that found the first treatment for COVID-19 at the end of April, which was really neat because we were able to give those to some of our patients here at Strong and watch them recover, partially because they were able to get this treatment. And now we've shifted focus a little bit and we're trying to develop a vaccine. So we're conducting large trials, some of them here in Rochester. We're going to enroll a couple of thousand people over the next few months, and we're going to vaccinate them, and then we're going to follow them to see if the vaccine prevents them from getting COVID-19. And hopefully by the end of the year, we'll have some data that shows us that one of these vaccines actually works. And then the real work starts, which is going out into community, door to door, and trying to convince people to get vaccinated so our Rochester's safe.
How has COVID impacted your family?
Well, a lot. I'm a Black woman and I have a very large Black family. Most of them live in New Jersey. And in March, just as we started to test new treatments and drugs to help treat people with COVID, my uncle got sick and he ended up in a hospital and he ended up on a ventilator and he died within a month of being hospitalized. And that was really hard. He was 64.
How does what happens to your family impact how you're working on COVID-19?
I think this is a very personal battle for me. I just saw a study that said if there was a vaccine, less than 50% of people would actually get it. And I think that's really true of the Black community. I hear a lot from Black friends and other people in the community that, I'm not going to get that vaccine. I'm not going to do that. I don't want to be a guinea pig. And I think, wow, Black people are dying at 3 times the rate of white people from COVID. They're being infected at 6 times the rate. They're being hospitalized at 5 times the rate. How are they going to refuse something that could save their lives and save the lives of their family? And so it's just become sort of a personal mission to me to make sure that we have a vaccine and to make sure that everybody in my family gets the vaccine and everybody in your family too, if I can.
Do you have any advice for YWCP students?
Yeah, I really hope that you guys value the opportunities that you have. I really hope that you don't sell yourself short, that you are able to take away from these 4 years a sense that anything is possible, that you're smart enough and strong enough and motivated enough to do anything you want to do. And I hope that the things that you want to do aren't small. Like, don't let them be small, like make them big. And whenever you reach a goal, pick a bigger one.